NUJ in the States. So we really appreciate them for that initiative.
You know what?
Forming the chapel.
You know what gladdens my heart? Being the pioneer chapel of the NUJ, and this was the initiative of a woman.
Say that again.
So we are very proud.
And you know we are women.
Why? That's the reason I'm saying we are happy, we are proud, and
we make things happen.
Of course. That was comfort.
We love you so much, Ma, because without you, maybe there wouldn't have been NUJ in Akwa Ibom. And the Friday was a significant day. We stepped away, a little away from the normal lecture. After having a lecture, we have to introduce agriculture, because even our governor is talking about agriculture. So we introduced agriculture, and we introduced other things like liquid soap making for people to at least make money from it.
Don't worry, we'll come to that. I believe that part is still there. But I must commend the people who join us. You said speaker after speaker. Of course, you have seen the praises from the people. We did not put words in their mouth. It's what they saw. It's what they have been experiencing, what they have been seeing AKBC doing. And not just AKBC, the TV chapel.
Thank you for correcting yourself. Juliet, can you take another story?
Oh, let's go there. Still on AKBC TV chapel. Media stakeholders, founders of Nigeria Union of Journalists and Veterans in Akwa Ibom have called on the present administration to look into the plight of AKBC by restoring its lost glory in order for the corporation to compete favorably with its contemporaries. The media appealed during the 37th anniversary celebration of the Pioneer Chapel of the NUJ, the AKBC Chapel of Akwa Ibom State Council, on Friday.
During a lecture to mark the 37th anniversary celebration of the AKBC TV Chapel, one of the founding fathers of the NUJ, Chris Ikpoto, said AKBC has remained in the status it was 37 years ago, pleading with government to give the corporation a facelift, as done in other state media-owned organizations. Comrade Ikpoto, who was in bended knees while making the appeal, said no facility in AKBC has been updated since its commencement of operation in 1987, the year he, Kamfat Umana, Hussein Economy and others started the Nigeria Union of Journalists in the state.
If you are a pioneer and you did this thing for, it's painful that the station still remains at the level that we started. 37 years after, people are not, government is not interested in moving this thing up, but they expect a lot of it, a lot of something from the kids. How do they do it? You come back after 6 years of my retirement and still be playing ABC. What is that what it was? What is that what it was? Then there's something wrong with the government. No, something is not wrong with it, it's wrong with the government.
The state chairman, Nigeria Union of Journalists, Comrade Moseto, said AKBC has been in a sorry state for far too long, beseeching the state government to overhaul the state of the corporation, knowing that it is owned by Akwa Ibom state government. Amos, who congratulated AKBC TV Chapel for attaining 37 and all the giant strides recorded over the years, lauded the chairman of the chapel, Comrade Aaron Paul, and DESCO members for putting up such a history-making event.
I want to thank you all for the support that we've enjoyed. Everything that concerns AKBC TV is always there to the State Council. Today, our emphasis is more on ensuring that we keep AKBC TV on the air news. I am very excited about this thing because several months ago, when the governor said he was going to make AKBC TV go on the internet, DSTV. It is one issue we have been emphasizing, but before we go to that level, let us try to overhaul the station so that of the modern day institution to run successfully.
Others who lended their voices to the AKBC matter were the AKBC TV Chapel Chairman, Comrade Aaron Paul, a director in news and current affairs in the corporation, Justice Udosoro, press secretary to the wife of the governor, Comrade Ura Utbekong, special assistant to the governor on electronic media, Comrade Samuel Ayara, and others.
We will continue to improve, innovate, tell stories that matter, and provide a platform for voices that need to be heard. Let me use this opportunity to call on government to look into the plight of AKBC and restore its lost glory, so that the level of the heroes past in the corporation and in the chapel will not be in vain.
We see the hallmark, the tradition, the spirit, the zeal that belongs to the ultimate in television broadcasting, to the ultimate in humanity.
Really, it also really got me emotional when he knelt in his bid to getting government attention to AKBC. I think it is a worthwhile venture. It is a thing everyone would love to see. Everyone would, reasons anyone, even people that do not love AKBC would love to see AKBC do well.
I also like to draw something from what Elder Chris is going to give. When he made a very personal appeal to government, our government should inject more resources into AKBC. And we going forward, and with their support and with their encouragement.
The anniversary celebration featured a lecture on broadcast journalism, adapting to trends and digitalization by Clement Bariku of the Nigerian Television Authority, liquid soap production techniques by the AKBC TV Chapel Chairman Aaron Paul, and hybrid pepper cultivation tutorial by Miss Emmanuel Akban, a former director with the Ministry of Agriculture.
We use so many preservatives when we make food, so I don't like using other things so that it can be harmful. This is salt. Salt is a preservative. When you put it, the liquid soap can stay as long as 1 year and above. And like I said, this is 1/8.
If it is pepper, they will be ready for transplanting. This one here, this is 82 days old. Now that is ready down, you can transplant them.
AKBC Friend Award was presented to a former Commissioner for Agriculture, Dr. Blared, for her love for AKBC, the chapel, as well as service to humanity.
Dr. Glory Edith, President, Founder, Mary Slater Akanjo Foundation, Friend of AKBC, award in recognition of his support to AKBC, AKBC TV Chapel, and humanitarian service to the informed honorable. Dated today, August 30, 2024. Congratulations to you now. Because I'm here, because of the love I have for AKBC, and especially the television channel. I want to thank you for, being so organized. If you are not organized, you won't plan for these events. And I want to thank the leadership and congratulate you, Iano, and your executive members. I've been telling people to manage people from different mothers. It's not a simple thing. If you meet in any organization or association and you are able to plan for events, because no matter how good you are, everybody cannot love you. And if everybody loves you, then there is a problem somewhere.
The chapel presented gifts, pepper seedlings, and liquid soap to members and guests at the event.
It was still an event, and I'm happy that we pulled through. But one thing broke my heart, Juliet, when that report was running. When I saw on Friday how Mr. Boto knelt down to beg Akwa Ibom government to come to the aid of AKBC, I shedded tears because we've suffered for so long. Imagine that the man said in 37 years of AKBC, no facility has changed, has been changed. Everything is still intact the way it was. You can't do that even in your house.
Even the car you drive.
Yes, you keep updating everything. You keep the upgrade going so that you can have a good result. So how can they start AKBC in 1987 and up till now we are still using the same facilities? I think it's wrong, Juliet.
37 years after. I think, please, government, come to our aid, just like the veteran pleaded that our facilities should be changed so that it will make the work easy for us. We are trying. In fact, that's why we are magicians. We are called magicians.
Yes,
of course. I must also commend the beautiful woman that was honored with an award. This is the one woman that has patronized. She is still patronizing AKBC TV, and the support, the contributions. This is a woman that loves Akwa Ibom thing.
You can say that again. You remember that time she used to give us Gary? She gave us Gary. She gave us rice, and she's been supporting
and
everything we do.
That's the support I'm talking about.
Honestly.
And every little thing she must make sure it's running on our television, and she doesn't look down on our television despite the facilities.
Yes.
You deserve the award.
Honestly, we are just here to tell her we love you for all you do for AKBC. That's why you were honored with that award.
Friend of AKBC TV Chapel.
That's very true.
Okay, here now to the next story.
The next story is still on our anniversary. I hope you are not bored.
Please don't be offended.
Because today we have the airwaves. Friday, August 30 was a day to remember for participants and members of AKBC Chapel of the Nigeria Union of Journalists. It was the 37th anniversary of the chapel that featured a lecture on the theme Broadcast Journalism, Adapting to Trends and Digitalization. Other features were training of members and guests on liquid soap production and how to cultivate hybrid pepper. Ura Boson reports.
The anniversary lecture of the AKBC TV Chapel, presented by Clement Barakui of the NTA, took the participants through the new trends in news reporting, such as using phones to record news items without a big camera and editing news too in phones through an app.
Modern broadcast journalism has incorporated a lot of the blend of text, audio, video, and interactive elements. So this multimedia approach enhances storytelling and engages audiences across different platforms. By the time you set out your news, there are a lot of things. The audience, there are a lot of options there for audience to interact with you. Can decide to use it text message, there are text messages attached to it. You have the audio and then you have the video. So you don't miss anything. What I do is either the audio is not there, when the video is there, you have the video and the audio, then you will not be able to get the text.
The chairman of the AKBC Chapel, Comrade Eyaranapo, took the audience on liquid soap production, which she enumerated the chemicals used and quantity of water in producing quality liquid soap. She said training can equip members of the chapel to acquire new skills in order to make money.
So we are going to pour in Texapon. Remember I said this chemical is called Texapon. So we are going to pour in Texapon, step by step. The Texapon I bought was in a bottle. They will give you in a bottle, sell for you in bottled water. And when you have that, you come and soak it in. For 20 liters of water, you need to soak it with 8 liters of water to dissolve. so that after you can pour it in. So stay it for 30 minutes, between 30 minutes and 1 hour.
At the event, former Commissioner for Agriculture, who is also the President, Mary Slessor Kanklo Foundation, Dr. Glory Edet, commended the leadership of the Corporation TV Chapel and the present Chairman, Comrade Eyano Paul, for her zeal, diligence, and passion towards the growth and development of the AKBC TV Chapel. Dr. Ede, while appreciating the chapel, pledged to always support AKBC and promise empowerment of some widows as well as less privileged in the corporation.
By the special grace of God in Mary Slessor Kanklo Foundation, we've tried our best to touch lives and we'll continue to do more because Mary Slessor's legacy must continue in Akwa Ibom State in Nigeria and beyond. So I want to appreciate all of you for coming together as a family to plan this. I really appreciate you and I want to encourage you to keep on doing the good thing. You know, when you do good things, you yourself, you'll be happy with yourself.
The event climax with members and participants thrill with sumptuous delicacies and other packages. Udroga Basikusen, AKBC News.
Well, this is still a thing, a chapel thing. Well, I'm so proud to be a member of the AKBC TV Chapel.
You can say that again.
Yeah, let me give it to the guest lecturer. Honestly, Clement did very well. Clement is our colleague. We decided to try him as an ESCO and he came out and he succeeded and he made us proud. So Clement from the NCA, thank you so much. And another thing there was the Juliet, you see that we had to divert a little. We had to diversify. You know that what is happening in the current economic situation. So we had to
be dependent on one source of income.
We delved into agriculture. We brought an expert there to teach us how to plant hybrid pepper. It was a nice idea. He also came with the seedlings that the chapel paid for, and he distributed not only to the chapel members. You would have seen how the guests that came were rushing for the pepper, and the liquid soap production. So it was a nice idea, Juliet.
Of course, for you to cultivate pepper nowadays, if you go to the market, pepper is even costly than tomato.
Pepper is like gold.
It's like gold. A little of it, 1,000, 5,000. How can before in the past we did not consider pepper as something that can be that costly.
Of course.
But now so it's necessary for us. Of course, it was not only the members of the TV chapel, others. And did you see that outsiders, when they heard that there's something like that,
they rush to rush.
The passers-by had to rush. It's necessary. And for the liquid soap production, wow, there's a lady that said right away I'm going to the market to get all those condiments.
Thank me a little now.
Don't worry, I'm coming to you. All those things, so that she will start her own personal business. She wants to be the oga of them all. So from there she will start teaching another. That's the benefits of the training. That's the benefits of the celebration. And let me not forget my chairman. You can see my chairman turning the liquid soap. She was the one mixing. She was the one teaching people how to put the pepper. It's like putting salt. It's like putting pepper. It's like adding other flavors, other crayfish in the soup. Wow!
You know where I learned that? In my NYSC.
And that's good.
I learned that, and when I came back, I was interested, and I had to further. And for more than 6 years now, I've been producing my liquid soap.
Oh my God! And I want to say it's because you wanted to learn. Nowadays, when our students are going for youth service, do they really want to learn?
They don't.
Please, when you are going, even if you are not a student, try and learn. If you see opportunity like this, grab it.
It's the best.
And make your life meaningful.
Okay, we move to the break now. Consultant cardiologist gives hints on saving a heart attack patient. Please stay with us.
This is where we belong. The place where life is beautiful. The peaceful ambience we enjoy when we live together, unity and love. I'm really it's only matter we know. Because stand together we go make up the town. We be brothers and sisters, no matter where we be. Everybody you know, it's only matter you know. Let's live together in peace and harmony.
Welcome to the last segment of Sunday News Special for today. Next story is on prostate enlargement. And Juliet, you have to take that.
Okay, do you know that as a man, not a boy of course, you have advantage of keeping your sex life active? Wow. To prevent diseases like prostate enlargement. Oh my God. Have you heard that? Let me take that again. Do you know that as a man, not a boy of course, you have advantage of keeping your sex life active to prevent diseases like prostate enlargement? Do you also know that even when you are down with prostate, it is not a dead sentence, as this ailment can be cured? Ian Paul in this report contacted a urologist on prevention and cure for prostate enlargement in men. The reports.
Prostate is a walnut-sized gland that rests under the bladder and surrounds the urethra. That is the canal that carries the urine. Prostates can be enlarged, becoming a serious ailment to men as a result of unregarded living, aging, urination problems, and many other factors. Now, how can one know that he has a prostate enlargement? The symptoms include constant urge to end frequent urination, especially at night, difficulty in getting the urine out, and emotional drainage. A specialist in urology and senior registrar urology in the University of Uyo Teaching Hospital, Dr. Torom Peter, highlights the risk factors of prostate enlargement.
When the prostate increases in size with age, like I said, studies have shown that from your 5th and 6th decade, it begins to increase in size. So when it does that, the pipe we call the urethra that carries urine from the bladder to the outside also passes through the prostate. So when the prostate increases in size like that, it now occludes, it compresses on that pathway for the urine to pass. It now causes what we call lower urinary tract symptoms, and that's when you see people start complaining of difficulty in passing urine, which has a whole lot of symptoms. Both the ones that we call irritative, that one's urinating every now and then, waking up at night more than 2 times to urinate, and then sometimes you feel like if you don't go to pass urine immediately, that the thing might just come out without your control. Then there's also the feeling of incomplete empty, where after peeing, the person still feels like something is still left inside. Causes of prostate cancer, there are a whole lot of them, but basically it's divided into modifiable and non-modifiable.
It is worthy of note that prostate enlargement and prostate cancer, similar as both, are difficult to differentiate, but prostate enlargement, also known as benign prostatic hyperplasia (BPH), is not in any way precursor to prostate cancer, and that prostate is common in black men between the ages of 50 and 60, according to Dr. Peter.
Family history. If you have a first-degree relative, like your father has prostate cancer, your son has prostate cancer, your brother has prostate cancer, the chances of you coming down with prostate cancer is much higher. And then, of course, as a male, being a man is a risk factor on his own because you have a prostate. That means there's a chance that anything can happen. Then we also also go to the other spectrum, which is the modifiable. That means you can actually improve on your lifestyle to reduce the risk of coming down with these issues. There's recently a link has been shown, obesity. People that are obese, there's a link between that due to elaboration of the male hormones. Once you modify your lifestyle, reduce sexual multiple, as you don't have multiple sexual partners, I think basically that will help.
Effects of the ailment include infection and bladder damage, low sex drive, weak erection, quick release, dizziness, fatigue, and blood in urine. The urologist suggests tests for men in their 40s to a certain trait of prostate and treatment.
Current recommendations is that you undergo PSA screening once a year from the age of 40 and above. You know, there's a reference range for the PSA. We call it prostate-specific antigen. It's recommended once you are age 40 and above, once a year we go check it. You also have to do something about the modifiable risk factors, like the diet, reduce fat in diet. Alcohol and smoking, even though I didn't mention earlier, they are still being implicated. Then sexual function. Although this one, it has an advantage because recent studies have shown that the more you have sex, the lower your chances of coming down with prostate cancer, because you are going to do those anaerobic toxins that are carcinogenic, you push them out during ejaculation.
With all the inconveniences of prostate, don't you agree that it is pertinent to go for a test regularly to know your status? It is also recommended that men perform their duty in the other room to avoid prostate-related issues, for a stage in time could serve 9. Iyageno Paul, AKBC News.
My naughty colleagues in the office were screaming when they heard that men have to do their duty in the other room so as not to come down with prostates. I never knew that prostates can kill, but I'm shocked to hear that prostate has killed somebody of recent. And when Juliet read this first paragraph 2 times, I was laughing at her. They said, do you know that as a man, not a boy, of course, you have advantage of keeping your sex life active?
Very active.
That's what the urologist said, that it really contributes to not coming down with it. So as a man, make sure your sex life is active. Make sure that you function at the other room so that at least you won't come down with prostate. And if you come down with prostate, you have to go to hospital to be the thing to be detected early so that at least they can be cured. The urologist talks about too, from 40 years you have to make yourself available to be checked at always so that you don't come down with it.
No, they said from the reports, not a boy, of course. What about those who behave as holy than thou?
Like who?
Like say they are maybe the married ones, because I believe this advice is for the married, the grown up. You are a man, not a boy. What about those ones who say, I'm fasting, I don't want to I don't want to go close?
How can you
keep keeping yourself? Because they say keep your sex life active, and you refuse to go to the other room.
Why are you really hammering on that?
Well, it's the first paragraph. It's the first.
Well, it's the first. But you know that you know why I like my pastor so much, Pastor Okafia? He will always tell men, don't starve your wife. By not starving your wife, they have the opportunity to keep your anyway. So please, for our men,
when you watch and pray,
watch and pray. Please, as you're praying, make sure that the other room too, you are active so that at least you don't come down with prostate.
And please also adhere to what the urologist
has said, yes,
to keep your life so that you don't die just like
we don't want to lose another man for prostate
because of that particular disease.
May the soul of the man who died of prostate in these states rest in peace.
Amen. Oh my God, we still have another story.
Yeah, the Akwa Ibom State Ministry of Health Friday announced plans for commencement of Nigerian state level antiretroviral therapy impact survey aimed at improving the well-being of the people and designed to show how well HIV programs are working in the state, describing the survey as an initiative that would strengthen health systems to better support individuals living with HIV. The Commissioner for Health, Professor Augustine Umo, during a press conference, called on the people to cooperate with field health workers carrying out the survey. The reports.
It has been more than 5 years since the last survey, which placed Akwa Ibom State on a prevalence rate of 5.5%, was conducted. This is to determine how many persons who have HIV in the state have been identified and how many of them have reduced the amount of HIV virus in their blood to stem transmission. Professor Augustine Umo listed support for people living with HIV, information on policy and planning, and proving treatment outcomes as significance of the survey, which will be done across the 31 local governments in the state.
This survey is a significant initiative aimed at improving the well-being of the people of the state. The national council of areas is designed to show how well the programs are working in our private state. The information that will be collected on this survey will help us to understand three key outcomes. First, how many people who have HIV in the state have been identified? Second, how many of those identified are already receiving life-saving drugs? And third, out of those receiving drugs, how many of them have reduced the amount of HIV virus in their blood so much that they cannot infect another person?
The commissioner sued the Corporation of Residents of the state as well as the media and CSOs in scaling up community engagement so the people are better informed on benefit of a successful survey.
It is important to state here that the reason why people are having HIV drugs is to reduce the amount of HIV virus in their blood. When the amount of HIV virus in their blood is very low, then they will not be able to transmit HIV to another person. Objectives of the survey. The primary objectives of the ERT impact survey are twofold. The first is to measure the population-based HIV treatment coverage.
Appreciating the Akwa Ibom State government as well as critical partners in the HIV management system, the state programs coordinator, SACA, Dr. Inobron Akpan, expressed the belief that the survey would achieve its target.
30,000 households, 3,000 households from Akwa Ibom State. I don't know if you're taking it on a pro rata basis for local government, we may not have the exact population. The prevalence of HIV and AIDS is mostly in the riverine and rural areas, and also it's been discovered that our tertiary institutions, the promiscuity of sex in those places also increases it.
Let me commend governor there, a health conscious governor, because all this wouldn't have been possible without him. Health is paramount. Like they say, health is wealth. So for the people who are down with HIV, it is time that you take this opportunity for antiretroviral therapy impact survey to make use of the knowledge that will be given so that you can come down with the disease. I believe that there is no disease that can be cured. If medical care cannot cure, like they say, God can cure. So it's a very good initiative. Let me commend the governor again, because I know that he is very, very conscious of health sector of the state.
For as the survey is about to start, the cooperation that the health sector is seeking, please adhere to that. Don't be harsh to the people that will come around to ask questions. Be free to respond accordingly.
Actually, the last time.
When there is feeling of heaviness in the heart, abnormal sweating, and the feeling of vomiting, then there is an indication that you may have a heart attack. What is heart attack? What causes it, and what are the remedies? Are questions Paul sought answers from a consultant cardiologist with the University of Uyo Teaching Hospital.
It has become a common sight of young, old, and people of both gender holding their chest, complaining of severe pains. Sometimes these people survive if they get proper medical care at the right time, and in other cases they die. Most often than not, people attribute these sudden incidents to spiritual attack, presumably that the person has offended the gods or eaten a forbidden food. Well, according to a consultant cardiologist in the University of Uyo Teaching Hospital, Dr. Idamasirumo, their views and beliefs may be fetish, but the observations and veiled symptoms are clearly that of a heart attack that can lead to a cardiac arrest or other severe damages in the heart. Heart attack happens when there is a blockage of blood flow in the heart muscle. It is termed a medical emergency because without blood, tissues loses oxygen and die.
So heart attack is when there is a blockage of the artery that supplies the heart. And this blockage could be partial or complete, and it could lead to a cardiac arrest, can lead to destruction of the heart muscles, and many times the patient dies. So it's a very common condition affecting our people.
The cardiologist mentioned symptoms of heart attack to include tightness of pain in the chest, neck, back, arm, fatigue, abnormal heartbeat, and anxiety, and also talked about the causes.
How do you know if you're having a heart attack? A lot of people experience chest pain. After a few minutes, the person died. So a lot of people, that's a common sign. Some people, the pain can be in the abdomen, maybe the upper part of the abdomen. And the common things that can cause heart attacks are raised blood pressure, so hypertension. Many people are going about with very high blood pressure and they don't know that their blood pressures are high. High blood cholesterol. Many people do not check if their cholesterol levels are high. Also diabetes. So if your blood sugar is high, it predisposes you to have a blockage in your artery.
Studies reveal that women are likely to get typical symptoms than men in heart attack. So, what should be done when someone has a heart attack?
If you think you have a heart attack, you should get to the hospital as soon as possible. You need to see a doctor so that you can be examined and more complications can be prevented. So the sooner you can get to the hospital, the better for you.
We sought to find out how much people know about this killer disease. Here are their views.
Actually, yes. Because attack.
Heart attack is a condition of the heart. The problem that we have that make us to
Heart attack is a sudden stage where the heart ceases to function. Some of us who have read where there is no doctor, I think the first thing that is recommended is aspirin.
Well, I really know because I've never experienced it. I don't have anybody around me that has ever been in that condition. It's a very well. Maybe I look at them there, I look at them there, I wouldn't them in the room. I wouldn't the heart attack.
Although the cardiologist mentioned that the best remedy for heart attack is to rush the patient to the hospital, medical science also recommends that there should be a knowledge of CPR.
90 degrees. Straight, absolutely. and then you start compression in the middle. Depress good 5 centimeters. Unless you depress it from 5 centimeters, your heart will not get compressed. 1, 2, 3, 4, 5, 3, 0. 30 compressions. After this, seal your lips on the lips of the patient. Deep breath. And quickly again feel the lower end of the sternum. Put your hand in the lower and compress. 1, 2, 3, 4, 8, 28, 29, 30.
When you notice someone experiencing a heart attack, call out for help immediately. Assess the victim for a response and look for breathing. If you do not feel a pulse within 10 seconds, perform 5 cycles of CPR.
Well, like they say, to be forewarned is to be forearmed. It is better to avoid things that may lead to heart attack because you may never live to tell the story of what happened. And if it happens, meet a doctor immediately. So many people have survived, but it just depends on the degree. A lot of people are dying in their sleep. We're hearing this, and but I think if this is a wake-up call for everybody, that you have fewer incidences of people dying in their sleep. It may have been a heart attack, may have been a stroke. We will see a cognaba de serubia, a serubo, ukanime, ipo, utapeyo, iden men. Maybe a cough, I've been a cough for you. If I'm not coming, a ball come, you don't be better for us. I'll be better with the for you. Prioritize your health, for health is wealth. Paul, AKBC News.
We like to emphasize every time that health is wealth. So if you know that you have a problem, please rush to the hospital. And for heart attack, is a very serious issue. It's not only the heart attack. If you have any problem, if you feel anything, go to the hospital. Or better still, prevention is better than cure. Not just
anything. When you feel uncomfortable, you can't really tell.
Yes.
Just rush yourself to the hospital.
Okay, that's where we draw the curtains on today's episode of Sunday News Special. We know that for sure you've learned one or two things. The reason you have to follow this program every Sunday so that at least if you miss, you can also watch us on Facebook, YouTube. We are all over. So that at least if you've missed tonight, you can watch us again and go through what we've talked about today. It was very nice to have you, and we know that you're happy to have joined us today. From the hands that are helping us, Emmanuel Efiong, Victoria Efiong on the camera, and every other person, not forgetting my production editor, Urwagabase Bosen. We love you for being with us. Juliet.
Thank you for watching. And stay tuned for next week edition. We're gonna be back-to-back entertainment. Of course, that's what we do. That's our business.
Say that again.
So next week Sunday, don't miss it.
Good night. Remain blessed.